Welcome to Plastical Review. Let's go through the latest papers on body contouring surgery for the month of May 2017. And we start with a study on PRS by Ronald Bozert and colleagues regarding the benefit of body contouring procedures on massive weight loss patients regarding their urologic symptoms. Now, they reviewed 97 patients that had body contouring procedures and found out that 44 of them had urinary incontinence. They passed out a survey 4 years after their surgical procedure and asked the patients whether they had a benefit or an improvement on their urinary incontinence after their body contouring procedure. They found out that 48% of the patients had an improvement on the frequency of their incontinence, while 34% had an improvement in the amount or quantity of their incontinence. They also found out that 21% of the patients had a complete resolution of their incontinence after having had a body contouring procedure, while 9% of the patients feel that their incontinence worsened after the surgery. That was 4 patients out of the study. The authors did argue that these 4 patients, and due to that it was 4 years after this survey, that of course aging could have worsened the outcome of their incontinence. Nevertheless, it was statistically significant that most of the patients improved in their incontinency symptoms after body contouring surgery. The authors argued that these patients that had worsening of their symptoms had or 2 times increase in their weight after surgery with regards to the other patients, and that this could have had, of course, an impact on the clinical outcome of their urinary incontinence. Nevertheless, of course, the study shows that it was highly significant, the improvement of urinary incontinence after body contouring procedures in patients that have had massive weight loss. And the next paper on body contouring this month is in ASJ, and it's by James Zins and colleagues from the Cleveland Clinic. They studied the relationship of age with complications after abdominoplasty procedures. Now, they performed a retrospective review of 129 patients going through abdominoplasty procedures, and they divided them in 2 groups. Individuals with the age of 60 and older, which included 43 patients, and those that were younger than 60 years old, which were 83 patients, and found that there were no difference in appearance of complications post-operatively. So they argued in their discussion that performing abdominoplasty procedures in well-selected patients over the age of 60 is safe, and that age is not a risk factor for complications in abdominoplasty. Now, the comment by Kai Higdon from Nashville, Tennessee is excellent, and actually Kai Higdon is the author of another paper on age as a risk factor for complications in abdominoplasty. Actually, Kai Higdon is the co-author of another important paper that evaluated the risk factor of age in abdominoplasty patients, and they actually found that abdominoplasty performed in patients over the age of 80 carried out more complications or more risk than in those under the age of 65. Nevertheless, he argues in his commentary that definitely abdominoplasty can be performed safely in older patients, and that the element that is key in the safety is, of course, patient selection. Definitely a very interesting read. And the last paper we're going to review this month on body contouring surgery is also an aesthetic surgery journal, and it's on gluteal augmentation. It's a systematic review, actually quantitative studies evaluating gluteal augmentation. It's performed by Carlo Oranges and colleagues from Switzerland, and what they did is that they reviewed 52 papers pertaining to gluteal augmentation, comprising over 7,800 patients. They found that gluteal augmentation procedures in these studies could be summarized in 5 techniques: gluteal implants, fat grafting, flaps, tissue rearrangement, and hyaluronic acid. The conclusions of their study was that gluteal augmentation was generally a very safe procedure, that implants had the higher incidence of complications, mainly due to either infection, wound dehiscence, or seroma, and that fat grafting had the least number of complications, but did have the worst or more severe complications with possible deaths due to fat embolism with fat grafting techniques. Now, the commentary to this study is excellent. It's performed by Douglas Senderoff from New York, who actually just published a paper on PRS February on revision gluteal augmentation. And he actually compares this systematic review with Sami Sino's and colleagues' excellent review from PRS last year, also on gluteal augmentation. And he goes through on his commentary on how complications from implant-based gluteal augmentation can be greatly reduced through several techniques. And lastly, he states two problems with fat grafting. First is an undercorrection with fat grafting due to resorption, or not enough take of the fat graft, which he says is a problem that is often underreported, but it is a true concern for many patients that have gone through gluteal augmentation with fat grafting. And he comments that this can be a real problem for plastic surgeons, since there's been already 23 cases of deaths reported after gluteal fat grafting augmentation just since 2011 in the US alone. So definitely something to be concerned about. And that's all for body contouring procedures for the month of May 2017. Hope to see you all next month on Plastic Review. Thank you very much.